The Psychological Association were also there. They've been speaking.
You know, when we talk of mental health, many of us may have different understanding about what it is. But mental health is basically about any life event that rocks our world. It can affect the way we think, the way we feel, how we behave, usually in a negative sense. And COVID-19 is such a life event we are talking about. And that presupposes that we are all potential mental health patients. In a sense, COVID-19, we don't need to introduce it. It has become so devastating that children cannot hug their grandpas, their grandmothers, and they cannot be cuddled in return. Almost every facet of our society has been affected by the spread of COVID-19. And this novel coronavirus, by its nature, spreading patterns and manner of behavior that continue to dribble the scientific world, introduces a more psychological virus: fear, panic, anxiety, helplessness, some signs of depression. And I think all of us may have found ourselves with these descriptions that I've given. Think about these words related to COVID-19. You hear of virus, either in the health sector or in the IT world. Virus means you are likely to lose something. Think of isolation. To be isolated is not something pleasant. It's not comforting. Think of quarantine or quarantine. It is not something comforting. And lastly, look at the current one all of us and many countries are enjoying: lockdown. To lock and down is not positive. And that is why the inclusion of psychologists with Ghana Health Service, the Ministry of Health, and other stakeholders became very relevant. And even ultimately the Ministry of Information became very relevant. Just to help you appreciate why our services were more important, think about these. Look at the effect of confinement and social distancing. We are Ghanaians. We are Africans. We have our ways of behaving. The social psychologists will be interested in looking at how one person interacts with the other. And now there is a barrier: social distancing or physical distancing. So we can't do things the way we used to. And that becomes a challenge we need to adjust to. And as we socially distance ourselves, boredom may set in. The relationship between us and our friends, our family members, our work colleagues, all these may be affected in one way or the other. How we even deal with children, older ones, the developmental psychologists will be interested, and that is what they have been doing, to look at how we can help people at different stages in their lives in fighting COVID-19, and especially vulnerable groups. Some may already be having bipolar or existing mental health situations. How do we assist these ones? Think about the workplace. Indeed, the industrial and organizational psychologists or business psychologists, they have been working with organizations to cope with this changing trend as a result of COVID-19. We cannot operate the way we used to. Many people may have to work from home. What HR strategy do we have? How are we managing the people while they are home? As employees, how are we managing ourselves while we are at home and still ensuring steady business continuity, among others? These are all important parts. Think of the likely potential job loss. How are we going to discuss this? Engaging employees and all that. The business psychologists or industrial and organizational psychologists, we are working with organizations to ensure this is done. Think of the public behavior, the panic buying. Look at the offending and exploitation that is going on. Why should we expect people to behave this way, especially in times of crisis? The community psychologists will be interested in looking at how indeed we can promote community-based interventions, how we can help one another to ensure that all of us take.
And those are excerpts from the press conference held earlier today by government and state authorities on health.